all of you to our October Public Health Cafe. And the reason why we selected to do this cafe on our workforce education report is that through the last couple of years, the Training Center has been collecting some pretty valuable data. And while we've kept it in-house, we've done a lot of planning based on that data, we really felt that this year we had enough data to really share with our community partners and with others in Indiana that might be interested in this workforce education needs and gaps that we're finding. So what we plan to do is do this once a year so you can see the results of the survey data we're getting. As I work with especially statewide partners, we see that a lot of people are asking the same questions, doing a lot of surveys to the same people. And if this can be of use to others, then I hope maybe that it reduces the strain we're putting on our workforce. So what I'd like to do today is first encourage you to use our hashtag anytime that you want to say something about the cafe and what's going on. You can use this hashtag. We do encourage the use of cell phones in our program, mostly as an educational tool. So feel free to follow Freddie especially at this hashtag and add your comments if you'd like. So today's objectives are pretty simple. We're going to look at what our purpose is as a training center. For a lot of people who have known us over the years, we've really changed what it is that we do in this state. And then we're going to look at the core competencies for public health professionals. This set of competencies has been around for several years, but there is a recent change in the competency sets. And this is a really important baseline tool that we use to collect data. So I want to show you what that looks like and some resources on it. And then we're going to look at the results of our needs assessment. I'm going to show you the competencies that we found were most important to our respondents. And I'm also going to share with you some of the gaps we found in educational programming. And then we'll talk a little bit about our potential next steps and what we hope to do as a training center to address some of these needs. So let's start by looking at the training center itself. For a while, we were known as the ISDH IUPUI Collaboration on Education, and then we changed over to the Mid-America Public Health Training Center. And this was a partnership and collaboration with the University of Illinois Chicago and was HRSA funded. We were with Math Tech for several years, but broke away in 2009 so we could spend more time working on Indiana's issues. And so then we became known as the Office of Public Health Practice. On September 13th of 2010, we were awarded our own public health training center. At the time, there were 33 existing centers. There are now 40. And the mission of these training centers is really the same, and that's to provide education and training to our public health workforce. What's interesting about this network is that we really do work together. Every month we talk, we have lots of special interest groups. We're always looking at ways that we can collectively provide education and training. So not one of us is out on our own, but using collective resources. So HRSA, who is our funder, has some guidelines for what it is that we need to do. And you'll see here on this slide that the training centers are in accredited schools of public health or related organizations that are academic in nature, and they include public health agencies and organizations. We have a long history of working with lots of partners, and we continue that as part of the Training Center network. You'll also see on this slide that we have three main objectives. The first is to assess the learning needs of the workforce. The second is to provide training, and the third is to engage in strategic planning. It is not our intention to be the sole provider of education and training for Indiana's public health workforce. We're here to collaborate, to fill in gaps, and to help all organizations who provide education and training reach out to the constituents that they would best serve. So we connect the dots. We help people find each other, and then we offer education and programming when there isn't an opportunity to do so otherwise. So at the national level, we're pretty active, as I mentioned. We are a member of the Core Competency Committee, so we work directly with the Public Health Foundation, HRSA, and the the Association of Schools of Public Health to make sure that our workforce is aware and using the core competencies. We're also a member of the Bundling Committee, which looks at online programs by subject matter so that we don't duplicate efforts. We also are a member of the special interest groups of the learning management systems, and we are active in advocacy efforts through the Association of Schools of Public Health. So we're really trying through our advocacy efforts to maintain funding, not only for the training centers, but for all initiatives related to education and training. So, when we look at what we've been doing, our outreach has really increased. And this slide shows you the number of participants that we've served since 2008. And you'll see we started at 300 in 2008 and grew to 19,000 in this grant year cycle, which would have been the fall of 2010 all the way through the spring, summer of 2011. So we're pretty happy with ourselves and thrilled that we're able to serve this many people through a pretty small team. But again, part of our success is really our partnerships with other organizations, especially organizations like the Indiana Department of Homeland Security, the State Department of Health, local health departments, and other professional organizations. So this has truly been a successful couple of years for us, especially as we've become a member of the Training Center Network. So I want to switch gears and talk a little bit more about the core competencies for public health professionals. I've also linked this document to the Connect session, so you can download it there. But I've also included several links, and I want to take a few minutes to look at what the core competencies for public health professionals looks like now that we've had a major change. This is a great resource for us in public health, not only those of us who focus in on education and training, but for everyone who's looking to build a competent workforce. And that includes supervisors and individuals who want to make sure that they are learning the skills they need to be successful in public health. So as you may know, the Council on Linkages between Academia and Public Health Practice first created the competencies for public health professionals. And the idea behind this, again, is to look at what does a competent professional need to know in order to do their jobs appropriately. And for many years, there was just one big list. And there wasn't a differentiation in between what someone in early career might need to know and do versus late career. So in 2009 and 10, there was a kind of a redo of the core competencies, including a tier system. And you'll see here on the slide that now we have 3 tiers. The first tier is the entry level. This doesn't necessarily mean someone who is young and in their first career. It means that they're entry level into public health. And as we know, a lot of people who work in public health come from other sectors. So you can see this as kind of that first level of the public health professional. Tier 2 really focuses in on the supervisors and managers. It looks more at financial issues, looking more big picture, and how to have an effective team. Tier 3 is reserved for senior managers, CEOs, health officers, and commissioner type positions. And this is, again, looking more at leadership, looking at meta leadership, looking at very big picture concepts within public health. We found that this tier system has been extremely useful in helping us classify and look at each public health professional individually and what skill set they might really need. It's not necessary for everyone to know everything, but we do want everyone to have their part, their specialty, their expertise. And we want to provide training and education that really provides for that level. So you'll see the second bullet point here is really about what the core competencies do. And I really like the way they phrase this, which is why this slide is text heavy. The core competencies are a set of skills desirable for the broad practice of public health, reflecting the characteristics that staff of public health organizations may want to possess as they protect and promote health in the community. And you'll see that this links to essential services. So while essential services help us assess at a community level, the core competencies help us assess at an individual level. And that's the strategic difference between these two sets. So let's take the next step and look at what happened within our assessment. We have quite a bit of information and data on not only what makes up the public health workforce, but also what's most important to them on the job. What are they finding are the most important competencies within each domain? And then the next step is where are the gaps in education and training, and how can we start to fulfill that? So one of the things that kind of got us started on this is not just the efforts of the Public Health Training Network, the Center Network, but also looking at the reports that came from ISDH showing that the continuing education and research functions of local health departments were ranked the lowest out of all of the essential services. And so we really took that to heart and knew that that was a prime area that we really felt our focus needed to be on, is helping local health departments, nonprofits, other government agencies, and businesses understand what core competencies are and how important they are to improving our system. So the very first slide I have here is a little bit more about what we found. And I will say that these numbers are probably skewed a bit. We got 376 respondents by using our own listserv and asking our partners to send it out to their memberships as well. Now, the unfortunate part about this is that we didn't get to everyone. We got to people that we knew, but it provides some clues as to what those real needs are in the community. And so what I'd like to ask you is, when you see this data, what questions come to mind? What trends and themes do you start to see? And what do you think needs to happen, not just with the training center, but with all of the organizations in Indiana to help us improve our system? There are all sorts of unique examples of things that are happening across the U.S. with these core competencies. And if you hear about a state that has been doing work that you'd like to check out, what I recommend that you do is check out the Public Health Training Center Network and ask that training center in the state that you're interested in. If they don't know the answer, they probably know who has that answer. And you can find the Training Center Network on the HRSA website. Just type in Public Health Training Centers, and on the Association of Schools of Public Health. If you click on centers, Public Health Training Centers should show up. Well, thank you all very much for your flexibility and for allowing us to kind of revamp this presentation a little bit. I hope that you found some important information, some things that might help you. And don't forget that the Training Center is here to help you do your jobs better, and to partner and to collaborate on education and training. So if there's anything that you'd like to post together, or if you have needs, if you want to bring faculty in, even Dan, if you wanted to do a webinar with one of our faculty, we could certainly arrange those things. So count on us to help you with all your education and training needs. Again, you can email me with any ideas, suggestions, questions, comments at any time. Thank you so much again for attending today. It's been a pleasure being with all of you, and I hope to see you at another cafe soon. Thank you.